Hello, my name is Dr. Dewan S. Raja. Today I will discuss about constrictive pericarditis. So this is the inflammation of the pericardium with constriction over the heart. And the pericardium is the sac that surrounds the heart. Constrictive pericarditis is a condition in which the pericardium surrounding the heart becomes inflamed, thickened, scarred, and sometimes calcified and can compress the heart. So it is called constrictive pericarditis. Depending on the pathology, it may be very acute constriction, it may be gradual constriction. And this can compress the heart. This leads to reduced heart filling, diastolic dysfunction, causing a variety of symptoms related to heart failure. So the movement of the heart is restricted. So it's because there is compressing sac around the heart. So the diastole is hampered grossly because the heart cannot expand. The ventricles cannot expand. So if there is no expansion of the atria and ventricles, what will happen? In diastole, blood should go to the atria, like right atrium by superior vena cava, inferior vena cava. If there is constriction around it, the sac is constricting, then there will be lack of inflow of blood to the heart during diastole. And so the blood will ultimately go to the ventricle contract and pump blood by systole. So if the diastolic input is less, then the systolic output will be less too. So there will be variety of symptoms. Eventually, heart will fail. This is the normal heart here, and this is the sac around the heart, the pericardium. It has fibrous pericardium, parietal layer of serous pericardium, and visceral layer of serous pericardium. This is the inflamed pericardium. It is inflamed, so it will adhere to the heart. The inner surface may go through inflammation, calcification, and there may be scar formation. So what are the causes of constrictive pericarditis? Infection, tuberculosis, caused by Mycobacterium tuberculosis, viral, any virus, or bacterial infection, any other bacterial infection. Radiation therapy to the chest may cause constrictive pericarditis, cardiac surgery, following cardiac surgery, autoimmune disease such as systemic lupus erythematosus or rheumatoid arthritis, trauma or injury to the heart, idiopathic, sometimes we don't know the exact cause, chronic kidney disease in uremic pericarditis, post-heart attack pericarditis called Dressler syndrome. So these are the possible causes of constrictive pericarditis. What are the symptoms of constrictive pericarditis? Constrictive pericarditis results in symptoms of heart failure due to the heart's inability to feel properly, shortness of breath, dyspnea, particularly with exertion, is because low cardiac output, low collection of blood during diastole. So the person will have lack of oxygenated blood. So there will be exertion and associated dyspnea, fatigue and weakness, Cushman sign in jugular pulse on inspiration. Okay, in Cushman sign, usually in normal person during inspiration, jugular venous pulsation, the pressure goes down. But in case of constrictive pericarditis, it does not go down. So jugular venous pulse is not going to be low. In case of Cushman sign in constrictive pericarditis, swelling of the leg, ankles, and abdomen, edema ascites, okay, build up in the abdomen because blood cannot get into the right atrium because of constricting membrane around the heart. So there will be not only the superior vena cava, right atrium, upper part is constricted, lower part is also constricted, so that the inferior vena cava cannot drain blood to the right atrium. Distended neck vein, jugular venous distension. So we just have learned through the Cusman sign. Weight gain due to fluid retention. Hepatomegaly, enlarged liver. Orthopnea, difficulty breathing while lying flat. Okay. So in person lying flat, systolic function is also disturbed because the diastolic function is lost, and venous return will be again more hampered because intestine and other organs in the abdomen will compress on the inferior vena cava. So decreased preload. Okay, so certainly there will be decreased afterload. As a whole, the pulse will be weak, low volume pulse in this person with constrictive pericarditis. Okay. So if we go to the diagnosis of constrictive pericarditis, diagnosis involves combination of clinical finding and imaging. The diagnosis of choice is echocardiography, showing thickened or calcified pericardium and impaired ventricular filling. Ventricular filling because decreased atrial filling because of constriction. So blood comes from atria to the ventricles. The ventricular filling is also decreased. So the stroke volume is also less. Chest X-ray may reveal calcification in the pericardium. Cardiac MRI CT scan provide detailed imaging of the pericardium's thickness and any calcification. Cardiac catheterization measures pressure in the heart chambers, showing characteristic square root sign. So in cardiac catheterization, we'll get square root sign indicating restricted filling. ECG or EKG may show non-specific changes such as low voltage or non-specific T wave changes. So here is the square root sign is here in cardiac catheterization. This I have taken from Google. Okay, image. This is the square root sign in cardiac catheterization. So what is the treatment for constrictive pericarditis? Treatment of constrictive pericarditis often depends on the cause and severity. Options include medication, diuretics to help manage symptoms of fluid retention and heart failure. Okay, so diuretics increases the urinary output. So this helps in the management of symptom of fluid retention and heart failure. Anti-inflammatory drug may be used if inflammation is ongoing. Pericardiectomy in severe or chronic cases, surgical removal of the thickened or calcified pericardium. Pericardiectomy is often necessary to restore normal heart function. Treating underlying conditions such as infection, autoimmune disease, or inflammation that may be contributing to pericarditis. Prognosis of constrictive pericarditis. Prognosis depends on the underlying cause and whether effective treatment is initiated early. So early treatment is very important. In cases where surgery, pericardiectomy is successful, many patients experience significant improvement in symptoms and quality of life. However, untreated or late-stage constrictive pericarditis can lead to heart failure and other complications like atrial fibrillation, cirrhosis of liver, pulmonary hypertension, renal dysfunction, and pericardial calcification. And that's all about the constrictive pericarditis. If you have any question, please feel free to ask me. Please share the information with your friends. Please support my channel. Please subscribe me. Have a nice, wonderful, and blessed day. Bye now.